A new report just out this morning, accompanied by an urgent warning. Ontario doctors are calling attention to the dangers measles poses to people who are pregnant, expecting or planning to be pregnant as well. This is just out after 6 infants were born with congenital measles from unvaccinated mothers. And of course, Marianne, we had the case last week in Ontario of a baby born prematurely who died, in fact, of measles. And the doctor said that was a complicating factor. So this is out in the Canadian Medical Association Journal. And what does it say?
Yes, this was an editorial that was released just this morning, published today, really highlighting those dangers for pregnant people who may be infected with the measles. And among the many findings there, it said that those who are infected with measles have a higher risk of being infected with pneumonia, hepatitis, a higher risk of hospitalization as well. It also says pregnant people infected with the measles have a 10-fold higher rate of death compared to people who are not pregnant, as well as a higher risk of miscarriage or even premature pregnancy. Now, Heather mentioned the outbreaks here in Ontario, particularly in the southwestern part of Ontario, and we know that the medical officials here in this province have already confirmed that 6 infants were born with congenital measles, which comes with severe complications. And in those cases, the mothers of those babies were unvaccinated. On Thursday came the confirmation from the province that the Ontario had its first measles-related death. As Heather mentioned, that was in a baby born prematurely whose mother was also unvaccinated. This was the statement released from Ontario's Chief Medical Officer of Health on Thursday, saying the infant contracted the virus before birth from their mother, who had not received the measles, mumps, and rubella vaccine. The infant also faced other serious medical complications unrelated to the virus. And here in Ontario, 2% of measles cases is actually found in pregnant people.
So with all of that as the backdrop in those cases, what is the information people need to know, Marianne, in terms of protecting themselves?
Yes, because measles is highly contagious. And looking back decades ago, it was considered eliminated here in Canada in 1998. But we've got those lower vaccination rates, and that's why we're seeing these outbreaks popping up not only here in Ontario, but across the country. And earlier this morning, we heard from Dr. Christopher Labos, who talked about the importance of protecting yourself.
When there was no measles in Canada, this was not something we had to worry about. But as we're seeing more and more cases, this is becoming a concern. It becomes one of the things you need to check whenever you have a pregnant patient. So if you've caught measles in the past, then you're immune. If you've gotten 2 doses of the measles vaccine, then you're immune. But for a lot of people, especially people like me that were born between the years of 1970 up into the 80s and even into the early 90s, they may have only gotten 1 dose of the measles vaccine. So if you only got 1 dose of the measles vaccine, that is one of the things that needs to be checked, because you need your second catch-up dose to really ensure that you have long-term protection. And if you think about it, that is the age group of women who are going to be getting pregnant right about now. They may have only gotten 1 dose, and that's part of the routine checkup that should be happening with their obstetricians during their pregnancy.
So the advice from medical professionals is to get vaccinated before you even get pregnant, because the advice is not to get the measles vaccine while pregnant. There could be some complications and dangers there. But if you are pregnant and you are exposed to the measles, there is the intravenous immunoglobulin that can be given to the mother to reduce the risk. But the message throughout all of this is the importance of vaccinations.
Thank you so much, Marianne.